Welcome to today's webinar, today's edition of Medcan Presents. It's Tuesday, July 14. This is border crossing long and short-term considerations for travel to the United States. So this is the health and wellness series that happens every Tuesday through the summer at 12:30 p.m. My name is Christopher Shulgan. I'm part of the team that creates content here at Medcan, and I'm here with Dr. Aisha Khatib. I'll provide a brief bio for Dr. Khatib, and then Aisha, you're going to run through your presentation, and then we'll take questions at the end. And
Sounds
folks,
good.
if you do have questions, you just press the Q&A button at the bottom of the screen, and we'll try to get to this webinar does have a lot of people in it, and we'll try to get to everybody's questions at the end. And Dr. Aisha Khatib is the clinical director of travel medicine at Medcan. She's an assistant professor in the Department of Family and Community Medicine at the University of Toronto. She's trained in both family and emergency medicine and recently completed an infectious diseases fellowship in clinical tropical medicine at the University of Toronto. Okay, Dr. Khatib, I'm going to allow people to read on if they like. I won't take up anybody's time. You've had such an interesting career, and I love your story about working as a team doctor for rugby.
Yes, I've had some good times. I would love to go back to New Zealand right now. That's for sure.
That's what you're missing. That's what you're missing.
Yeah.
I'll stop sharing my screen, and then why don't we start with your? Oh, actually, let's do the poll. So, folks, we have a poll. We're going to start with a poll as a bit of an icebreaker. Okay, so I'm going to launch the poll. So the poll is: how long, folks, do you think the U.S.-Canada border should remain closed? So this is a multiple choice poll. So the first option is forever. This is for people who never wanted to go to the United States anyway. And you can see with, certain presidents, maybe that's an odd, but in any event, okay, so then 1 month, 3 months to the end of the year, and until a vaccine is available. Okay, so Dr. Khatib, what would you choose if you were going to vote on this poll?
Oh, that's a tough one. I would say at least until the end of the year, if not longer, depending on what the situation was, how it was unfolding in the States.
Okay, so let's end the poll. We'll show how people voted. So we have, I'm going to share the results here. So we have nobody picked forever. So we have a lot of people who are enjoy their travel to the United States. We have 11% in 1 month. We have 32% is 3 months, 32% exactly the same as to the end of the year, and then 32% is until a vaccine is available. Okay, that's great.
All right.
Okay, so let's start with your presentation.
Sounds good. Thank you, Chris. And thank you everybody for joining today. I am just going to share my screen here.
Oh, shoot. Okay, so all panelists. Okay, you should be able to share now.
Okay.
Perfect.
You can see that, Chris?
Yes, that's great.
All right, great. So thank you for attending today's webinar. We're basically talking about border crossings, long and short-term considerations for travel to the United States. And obviously there's a lot here that is out of really our control, but kind of trying to understand the background and the context of what's going on to maybe help guide decision-making down the future, especially when it comes to employees and companies and businesses that depend or have in the past done a lot of travel between Canada and the United States, and the implications of what the current pandemic means for that going forward. Okay. So currently, if we look at COVID-19 and the situation worldwide, we have over 13 million cases with over 500,000 deaths that have been recorded. In Canada, we have 107,590 cases with 8,783 deaths. And compare that to the United States, where they're basically almost upward of 3.5 million infections with 137 plus counting thousand deaths. And so if you actually look at the comparison of numbers, the US actually has more deaths than Canada has cases. And if you actually look at the statistics, it actually works out to being about 1 in every 100 American is infected with COVID currently. So the other thing is that the United States has more than 1/4 of the daily total of new cases, with over 66,000 new cases coming up on a daily basis. These are basically stats from the World Health Organization. And you compare that to the number of cases across Canada, where we're sitting at less than 500 new daily cases per day. So when you're comparing that, the numbers actually are quite staggering. So one of the reasons we're doing this talk today is to basically look at these questions that we may not know the answer to right now, but to start kind of thinking about what direction do we need to be going, and what are the implications from an occupational health perspective when crossing into the States in regards to a risk of infection. What are other alternatives to simply just banning US travel altogether? Again, some of these are out of our control in regards to what's going on with the federal government and orders that are in place. And of course, how long should we expect a closed border, which again is something that we don't currently know. So again, just giving a little bit of context, if you're looking at the new reported cases by day in the United States, this is a 7-day average of basically from the beginning of the pandemic. And we're looking at what happened back in April and May with case numbers. And then there was some effort put into trying to mitigate pandemic spread. But as things started opening up, we saw a huge rise, and this continues to rise. And if you look at it, the United States has over 60,000 cases being reported per day. Now, to give you some context, Wuhan had a total of just over 50,000 cases, and their entire total numbers counted from the beginning of the pandemic. So essentially, if you actually think about it, the United States is adding a Wuhan every single day in numbers to the US. So it's just staggering, actually. The numbers are, when you actually look at it and break it down, it's incomprehensible, actually, in regards to how fast things are spreading down there. So, you know, if we look at and break it down to the states, essentially we're seeing the same in total daily cases all across the United States, where every single state, I think except for 2, the numbers are rising. And if you look at Florida, actually just a couple days ago, they hit a peak of 15,000 new cases per day. That's actually, if Florida was a country, it would be the number 4 country in world if you were comparing total daily cases. So again, these numbers are going up, and there's no sign of them slowing down anytime soon. So if we look at the timeline in regards to what's been going on, advisory to avoid all non-essential travel outside of Canada. On the 16th, the Government of Canada banned entry of all non-Canadian or non-permanent residents into Canada. And on the 18th of March, the Government of Canada, in conjunction with the United States, closed the Canadian-US border to all non-essential travel. Following, on the 25th of March, the Quarantine Act was mandated with an immediate 14-day quarantine for all Canadians returning to Canada. And following that, there was an order put in place that travelers arriving in Canada who cannot isolate or quarantine in a place where they would be able to, where they would be in contact with those who are vulnerable, would potentially be designated a place by the Chief Public Health Officer. Following that, on April 17th, the Minister of Transport announced that measures requiring all air passengers to have non-medical mask or face coverings to cover their mouth and nose during travel. And then on July 3rd, the Government of Canada extended the requirement for anyone crossing the Canadian border to be isolated for 14 days until August 31st, and that's under the Quarantine Act. Now, July 21st is the current end date for the border closure, but I do believe that the US and Canadian government were in talks even up until last night, and it looks like that will be extended again for the 4th time up until August 21st, 2020, from the preliminary reports just from this morning. So the Quarantine Act is just really important for people who are returning to Canada to understand that it is a legal obligation. It's an order requiring travelers coming anywhere from outside of Canada to quarantine for 14 days on arrival. So they need to confirm that they have a suitable place to isolate where they will have access to basic necessities, including food and medicine. And this is actually being questioned and documented at the airport. And they do actually have an app now that you can put in all this information where it's kept. And there is spot checks that are being happening by police and RCMP to follow up on this. No one is permitted to quarantine anywhere where they could be in contact with anyone who potentially is vulnerable, for example, those who normally may live with an elderly person. And there are quite heavy penalties and fines that have been put into effect. So anyone who either falsifies information or fails to comply with these can be fined up to $750,000, or they can be even imprisoned. If somebody has been put in risk of imminent death or seriously bodily harm because of a failure to do so, the fines can be substantially larger and imprisonment up to be longer as well. So currently the Canadian rules are if Canadians return, they isolate for 14 days. There is a ban on most foreign travelers up until, for now, July 31st. And the sweeping ban that bars entry to all travelers who are not Canadian citizens, permanent residents, or people entering from the US for essential reasons. Now, just until a few weeks ago, immediate family members were given entry from the US to Canada. However, they'd still had to follow the self-isolation rules for 14 days. And travelers can really only enter Canada for travel that's deemed essential, and that goes for all Americans coming into Canada. So this has substantially impacted travel across the border. If we look at the land border, just between June 15th and 21st, there's been a precipitous decline in people crossing. So back in the same period in 2019, there were over 1.2 million people traveling across that land crossing from the US into Canada. And comparatively, during this year, it's been about 170,000 people entering, whereas most of those have been truck drivers bringing in essential foods, supplies, medicines, etc. So I think there's also a lot of discussion of what implies as essential versus non-essential. As non-essential travel between Canada and the US is prohibited. Under this order, essential workers are basically truckers bringing in supplies, healthcare workers who are allowed to cross the border back and forth. And the border is open for commercial traffic, for essential goods and foods, and those who need to cross for work. The recommendations currently are for no tourists, recreation or entertainment, or unnecessary business travel. Now, how is there actually risk related to travel from the United States? So if you actually look at the numbers before the lockdown of the cases being transmitted into Canada from travel, and again, in the beginning, before we started seeing a lot of community transmission, a lot of the cases, I mean, most of the cases were from travel. So about 26% of COVID-19 cases to Canada have been related to travel exposure. And out of those related to travel, 9% of them were hospitalized. Now, if you look at the numbers, just compared to last year, about 4.8 million Canadians returned to Canada after being abroad, with about 4 out of 5 returning from the United States. So just if you look at the habit of the travel between the US-Canada border, it's a substantial number. And the US for sure is our #1 potential importer of risk in regards to COVID. And if you break down the numbers even more, from the Public Health of Ontario, the confirmed cases of COVID-19 in Canada by travel history, and this is quite interesting because I know a lot of people think, oh, you know, a lot of the travel related COVID-19 was brought in by people traveling to China, and that was kind of the initial fear. But if you look at the Ontario case numbers between January 15th and April 16th, the case number was about 1,200. And of those, 404 were return travelers from the United States. And you actually compare that from cases of COVID-19 imported from China to Ontario during that same time frame, it was actually only 5. Now, this is actually replicates throughout the provinces. The same, if you look at the same chart for Quebec, there's about 373 cases from the United States in about a 1,500 case number, and 36% of COVID cases returned in Alberta were from the United States as well. So a huge percentage, almost a quarter of the percentage of confirmed cases coming into the US, coming into Canada with COVID-19 were from the US. And remember, this is just even in the first couple of months of the pandemic, when things actually weren't as high in regards to numbers. So you can see how this would relate if we're looking at what's happening now to a way higher risk of transmission. And if we're looking at numbers of Canada versus the US, and we're looking at potentially the risk of a second wave, it's likely that a second wave will come when we potentially open up that border and allow more travel to be imported, bringing in cases with them. So what are potentially the occupational risks and considerations to think of going forward? I mean, obviously now with the border being closed, travel isn't permitted for kind of non-essential business and whatnot, but down the road when travel starts to open up, thinking about what exactly are your risks to your employees and to your company. So what happens, for example, if your employee gets sick while down in the United States when they're already at capacity within their healthcare system? Will travel insurance cover them? I mean, we know that a lot of people are struggling to access to medical care. And I believe that just as of yesterday, it was something like 5 million new Americans no longer have access to medical insurance any longer just because they can't afford it. So, I mean, in regards to employees, will their travel insurance cover them? What about the quarantine? So in Canada, there's a required quarantine on return to Canada for 14 days. And that same quarantine is recommended by the CDC, but it's not required and not being fully enforced. So when those employees are either going to the States or returning to Canada, is that time period going to be a paid leave? You know, will they be able to work virtually from home during that quarantine period? What if they get sick during that time period? All of these things to consider about the potential impact of travel of your employees going to these places. What about if the situation all of a sudden worsens even more while your employee is abroad and all of a sudden there's new lockdowns in force? Will they get stuck there? Will they be able to come back if they're symptomatic? Currently, if there's a Canadian stuck abroad who is symptomatic, they would not be able to return by air. They may be able to return by land, but again, that would have to be judged at the border by health officials. And of course, what if they sustain a work-related disability, if they do go down to travel to the US against the recommendations that, you know, that travel shouldn't necessarily be deemed important or can be avoided if they do get COVID or obtain some sort of disability that is related to the work that they went down to. How will that impact your company and the employers that are working there as well? And of course, if you're outside of Canada, you still may, and this would, you know, obtains to not only the United States, but other places as well, you may have difficulty obtaining essential products and services. You may face strict movement restrictions and quarantines. Your insurance may not cover your travel or medical expenses. You may only be able to provide limited consular services given the emergency situation that we're still in. And of course, you'd have to find out whether you would be covered for medical treatment or coverage for extended stays outside of Canada. So a lot of considerations to think about even for future travel. In regards to predictions for the US-Canada border closure, you know, there's a lot of experts who basically have said that, you know, they're having over 50,000 cases, and on top of that, doesn't appear like they're getting this epidemic under control. So Dr. Isaac Bogosh, for example, said the US-Canada border should remain closed until next year. The US immigration lawyer says that he didn't think that the border would open until the end of the year. And recently, Colin Furness, who's an infection control epidemiologist, said the Canada-US border will only open if a vaccine is created or enough people have been infected with the virus to build herd immunity, which is still, again, a lot of information is unknown about that. There was a recent poll done of over 1,000 Canadians showing that 80% of them say that the Canada-US border should remain closed to non-essential travelers for the foreseeable future. So there is a lot of apprehension about what's going on down there in the States and protecting Canadians. 14% believe it should open now, but only in areas where infection rates are low. But it's hard to really establish that when you kind of look at what's happening in all the states with all the numbers going up. Like what's your definition of a low rate of infection? And then there's about 3% who said that they should open it immediately. So long term, likely we need to accept that the border will be closed, and it may be for the foreseeable future until things get under control in the United States. Unfortunately, even if they implemented stringent public health measures right now, it would still take time for them to come about and turn the corner, and they're not really taking those measures, unfortunately, although I did hear that they're going back into lockdown in certain areas of California as of today. And I think we just need to be very careful about travelers and the risk to our own Canadian travelers coming from high burden areas such as the US. So, of course, there's complications associated with the current restrictions, and that needs to be balanced against the health risk of opening the border. And of course, the economic disruption that would cause here if there is a resurgence of COVID-19 in Canada. And I think we should start really focusing the discussion to rational and safe ways to ease some of the restrictions down the road. Expanded testing, for example, might allow some travelers to cross if they can show that they've been recently tested as negative. That being said, domestic travel within Canada for now can be done relatively safely. And there's still a lot of question about safe air travel and can it be done? And that's something we're going to be addressing in next week's webinar. So of course, we know this is a difficult time for everybody, and the Prime Minister Trudeau has recognized that that essentially opening up too quickly would lead to a resurgence that may force us to go back into lockdown. And the director of the World Health Organization basically also states that, we're not even close to this being over. And unfortunately, the outbreak is accelerating globally as we're seeing in the numbers. All right, so that's kind of a synopsis of kind of the state of affairs for now. That's it from my side, Chris.
Okay, that's great. Gosh, the one, I took so much from your presentation. One fascinating thing for me was something that I didn't know, which was symptomatic Canadians would not be able to return by air. And so what you risk being stuck there with no insurance, right? That's kind of the big risk at this point.
Right, that's correct.
Okay, okay, so I'm going to stop your sharing and we're going to move into questions. We have quite a few questions. And okay, we have about 5 minutes until the nominal one, but let's try to get to everybody's. Dr. Khatib, your list about COVID cases by travel history in Canada, somebody asked, where was China on that list? And you referenced, you said that China was comparatively low. Can we go back to that quickly and just was China actually on the list just at the bottom?
No, so China basically, if you look at Ontario, it was 5 cases coming in. Quebec reported, I believe there was 0 cases from China into Quebec, and it was 1 case reported in Alberta. But yeah, I can show you I can go back to the chart if you'd like, but the chart basically cuts off, I believe, at the Dominican Republic, and that was the lowest number was 11. So if you actually look at the numbers coming in, comparatively, a lot of people think, oh, this was brought in from China, but the restrictions from travelers from China were actually implemented quite early. Like we're talking about back in February, we were screening travelers from China, from Hong Kong, from Taiwan, from Singapore, and from Iran, from Italy. So those were being monitored quite early, and I think there was a lot more restriction put on at that time as well. Okay. So I wonder if that's contributing to it, but also I think just the sheer number of volume of travelers from the United States were the ones that actually brought in the transmission.
Okay. Are there exceptions for the 14-day quarantine for essential travelers coming to Canada?
Yes. So there is, and it's based on, I guess, with healthcare workers and with truck drivers, there is certain permits that are being allowed for those who are in essential, who are obviously not symptomatic, as long as they are kind of maintaining low risk and continuing with their work with appropriate PPE and whatnot. So yes, there is exemptions for them.
Okay. And will they let people cross that have a positive antibody test?
So that is not being used at the moment to either stop or anybody coming in. All really a positive antibody test at this point shows that you may have been exposed. So it doesn't necessarily mean that you currently have it, depending on the antibody test that's being done. That is something that I know some of the airlines and whatnot are looking at in regards to, you know, there's different aspects of the antibody test. There's the IgM, which would show more of an acute infection versus an IgG, which potentially just shows if you've had it before. So it could have mean that you may have had it several months prior. So really the antibody test, if it's positive, yes, I would presume at this point they would let you in.
Okay. Okay. How close is the United States to herd immunity? So you hear a lot about herd immunity. Is herd immunity, is that 60%? Am I correct?
So we actually don't know. So at the moment, we're still not far enough out to, and the serum prevalence studies and whatnot, and the studies are still being done. And so we actually don't know, and we don't actually know if there even will be herd immunity or whether that immunity will last. So that's all being looked at right now.
Okay. If you're a Canadian who needs to travel to the United States, you know, let's say that you're a CEO of a company and your suppliers are in the United States and you feel like you have to go. Do you have to quarantine on that side of the border? Do you have to quarantine when you get into, say, Iowa or New York City or wherever you're going?
So as per the CDC, the recommendations are that you should be quarantining for 14 days. From what I understand, I don't know about their enforcement measures in the United States. But again, if you come back through, if you are a Canadian coming back through, then definitely it is required and mandatory. So on the US states, it is recommended that you should be based from the CDC. I just don't know how much it's being enforced.
Okay. So this is related to that, I think. So some countries allow entry with a medical certificate showing a negative test result within the last 72 hours. Who issues those certificates and how are they issued in Canada? I don't know if this pertains strictly to the United States because I don't think this applies to the United States, does it? But can you speak to this?
Yeah, it's something that we see at the COVID Assessment Center. So people traveling abroad internationally, some countries for visas or some countries even for airlines may require a negative test, usually up to 72 to 96 hours prior to travel. And so there's two points to this. If you're coming from outside of Canada, coming to Canada, even if you have a document stating that you have a negative test, for example, I know of 2 travelers who returned from China last week. They were tested at the airport in China. When they arrived in Toronto, immigration told them that they needed to be tested immediately, but actually they should have been put directly in quarantine. So quarantine for 14 days, regardless of the fact that they had a negative test. And the reason for that is that testing abroad, we don't know actually the reliability of that, but even for tests that we're doing here, there is up to a 30% false negative rate. So being mindful of that, being cautious about that, even if you came back and had a test done in Canada at assessment center and it was negative, it is still mandatory to quarantine for 14 days.
Okay.
If you needed a test to go somewhere else, you would do it at an assessment center and those results would be available online. You could take a photo of it or print it and provide that for whatever you need to for travel wise.
Well, so one of the questions speaks to this, which is why are the quarantines necessary if we're getting accurate testing? or is that supposing too much? Is the testing not accurate enough to ensure things? Like, so, you know, if I do have my negative test certificate, why am I still being required to quarantine wherever I'm going?
So again, it comes down to the reliability of the test, right? First of all, if it's done outside of Canada, we don't know exactly what type of test is being done and potentially the reliability. If you look at the testing done in Canada, okay, for the PCR testing, there is up to a 30% false negative rate. So you could have a negative test, but that doesn't necessarily mean that you'll be negative. And I've seen cases where, for example, they've come back for the first 3 or 4 days, you know, they got tested, they were asymptomatic. By day 10, they became symptomatic, they got tested again, and they were positive. So it could be that earlier on, potentially, it might not even be picking it up. It could be operator dependent in regards to affecting the reliability rate. And so to err on the side of caution and to make sure that there's control in regards to contact tracing and decrease the risk of transmission to others, it's basically watch for 14 days. That's why the testing isn't even recommended necessarily. It's just the quarantine to monitor for development of symptoms and to decrease, obviously, risk of asymptomatic spread as well.
Okay. Okay. Last question, I think, because we are over time. And I'm just going to read it out loud because it's quite a lengthy question. So forgive me if you covered this. I stepped away for a few minutes, but I would ask about crossing US-Canada border by air. It seems well known now that non-essential travel is allowed by air. What's the rationale for that? And second, is there any talk that returning cross-border travel may be allowed with something less than 14-day isolation depending on origin in the United States? Because this reflects that some states are much more, the disease is much more prevalent in some states rather than others.
Right. So yes, so Canadians currently can fly into the United States. And the reason for that is the US is actually only prohibiting visitors from certain countries. So it doesn't actually have to do with what we're mandating in Canada, it's what they're mandating in the United States. And they're only prohibiting people from entering their country from Brazil, China, Iran, Ireland, the UK, and about 26 countries in Europe if they've been there within the last 14 days. So those are the United States recommendations. And so that's why the flights are still open for Canadians crossing in. In regards to the 14-day quarantine for going to less severe states, I mean, if you look at actually the chart of all the states that I put up, they're pretty much all going up. The case numbers are going up in pretty much every single state, and those are continuing to rise. So it would be quite hard to actually mandate that per state. And you can imagine if there's like connecting flights or whatnot, how does that complicate things? How does that complicate exposures? So for now, it is until August 31st mandated that strictly 14-day quarantine, doesn't matter where you're coming from outside the United States, outside of Canada.
Okay, thank you for that. We're going to shift to looking forward. Dr. Khatib, this is, it strikes me that you are the perfect person for this as someone who both works in a COVID assessment center at St. Mike's and then handles travel medicine at Medcan. So you really are just every day in this, and so it's so great to have you. You have this stuff at your fingertips. I'm going to share my screen and start the slideshow here. Sorry, folks. Okay, so then, I have to go to the beginning. So let's go all the way to the end. Okay, future webinars. And I wish there was a way to go from Zoom into PowerPoint without having to all of a sudden max the screen setting, but in any event, there isn't. I've tried to do it many times. So next week's webinar, another fascinating one, our best, so by registrants, it's our best attended webinar ever. How to fly with Dr. Aisha Khatib. Should you just avoid air travel altogether? What if you have to fly? What's the best way to do it safely? Strategies for safe air travel. And to sign up for that, go to bit.ly/Medcan_how to fly. That's the the link right there. And then the next one, July 28th, Tuesday at 12:30. That's with Dr. Peter Nord and Andrew Zamakis. That's the second wave of COVID-19. Epidemiologists predict a second wave coming this fall. How should employers prepare? To sign up for that, we go to bit.ly/Medcan_second-wave. Find past webinars at Medcan's YouTube channel. That's youtube.com/MedcanLiveWell. We'll be doing webinars through the summer every Tuesday. Future ones in August. I think we're going to do one on masking. We're going to do one about safe schools for kids returning to school. We've got a great load. So thanks to everyone who participated in this. Dr. Khatib, you put your Twitter handle up. If anybody has any additional questions, can they hit you on Twitter?
Absolutely. Yeah, it's Aisha Khatib.
And that's great. Okay, thanks everyone, and have a great week.